Good morning, good afternoon, and good evening to the Pasteur Network community, and welcome to this Pasteur Network monthly seminar. Thank you very much for joining us today. I'm Hisham, I'm in charge of the Pasteur Network knowledge sharing platform, and also in charge of the Pasteur Network monthly seminars. So, as usual, we will begin our seminar by giving the floor to the speakers, and after that, we will have a Q&A session. It will at least like maximum of 1 hour. You can share your question in the chat during the talk or ask your question directly during the Q&A session. Please make sure that your microphone and camera are switched off during the conference and to ensure that the seminars runs smoothly. The seminar is recorded and will be shared within the community. Okay, so today our seminar is entitled Innovating in Dengue Therapeutics and Beyond, DNDi's Global Contribution. And for this seminar, we are very pleased to have with us our speakers, Eric Stobbaerts, International Development Director from DNDi, and Isabela Ribeiro, Viral Diseases Cluster Director. Some information on our speakers. So Eric Stobbaerts brings a wealth of experience in global health and humanitarian strategic work, currently serving as the International Development Director at the Drugs for Neglected Diseases Initiatives. And with over 2 decades of experience, Eric has held significant positions, including General Director of Médecins Sans Frontières Operational Center in Barcelona for 6 years. During this time, he led critical humanitarian operations across various crisis zones worldwide, demonstrating leadership, strategic thinking, and a commitment to aiding those in need. He also expanded MSF's Médecins Sans Frontières institutional presence outside Europe, showcasing his ability to foster impactful partnerships in the realm of tropical neglected diseases and equitable health research collaboration. Eric's expertise spans several key areas like directing global health teams, office operations, governance, institutional accountability, engaging stakeholders and cultivating external relations, fundraising by identifying donors, crafting narratives, advocating and securing resources, advocating for policy change to address neglected diseases, and institutional development and change management. Our second speaker is Isabela Ribeiro. Isabela is a medical doctor with postgraduate training in infectious diseases and over 25 years of drug development management experience focused on infectious diseases. She's working at the DNDi since 2005 in projects on malaria, visceral and cutaneous leishmaniasis, and on Chagas diseases. And she's also involved in the development and registration of 4 DNDi available products, like artesunate melflufen fixed dose combination, the pediatric dosage for besnidazole, ABC 3TC LPVR, fixed dose combination, and also the combination of sofosbuvir and new directly acting antiviral ravidavir. Isabela, is the DNDi coordinator and technical focal point on the collaboration with Chemo Exiltis on the registration of besnidazole in the US FDA, granted orphan drug designation and the priority review voucher. So she's currently the director of the DNDi viral diseases cluster with responsibility for the portfolio on HIV, HCV, and dengue. Isabela led and helped establish the DNDi Dynamic Portfolio Unit with responsibility for scoping, exploratory evaluation, feasibility assessment for support, and integration of potential new R&D areas for DNDi. Successfully delivery and exploratory of feasibility assessment on snake bites, on the portfolio integration of dengue and cryptococcal meningitis, working transversely with the DNDi department, regional offices, and external stakeholders at WHO, Médecins Sans Frontières, academia, and industry. Okay then, so I'm happy now to leave the floor to our speakers, who will present us the role of DNDi in innovating dengue therapeutics and beyond, and I will be back for the Q&A session. So Eric, I give you the floor for the first talk.
Okay. Thank you, Sham. Hello, everyone. It's an honor and very exciting to actually be with a representative of the Pasteur network, a wealth of diversity around this virtual table. We're very happy to join you, me and Isabela. And so I'll be presenting, Bushra kindly will upload the presentation. And we'll be presenting basically generally DNDi for some of you who may not know the organization, where we come from, where we're going. And then leave then the floor to Isabela, who will really talk about our disease portfolio and deep dive into the dengue, since this is the conversation today with you. We'll allow time, I understand, for Q&A and time for questions and get to know each other better. So the first slide I wanted to present was basically a bit of where we come from. And for those who haven't heard about the DNDi, the acronym sounds a bit bizarre, but it basically summarizes a drug for neglected disease initiative. It's a partners-based model that was really created out of trying to find solutions for neglected disease and neglected populations by building a model of partnering, finding partners in different sectors of the world. And so there was a scoping worldwide after the Nobel Peace Prize of MSF in 1999. We published back then an article to show the imbalance in research and how many diseases and patients were left by the pharmaceutical system, and how a solution had to be found. So we thought that we'd be a bit smarter and try to provoke the system and create a partnership-based model, which you see here represented by different institutions from around the globe, who are now our founding partners, but also based in Brazil, Kenya, and India, and Malaysia, but also Pasteur is a founding partner together with MSF and the World Health Organization. And all these institutions you see on the slide are actually sitting on a regular basis every year to monitor what we do at the executive. So you know, Pasteur is a founding partner of the DNDi, and you are represented and drive our strategy. So you're actually not, you're more than listeners here, with in a way being a bit rendering account back to you as a founding partner. So 20 years later, maybe the next slide is in a beautiful adventure, and of course a wealth of footprint, very global. And I want to insist on this global footprint to highlight the connections, obviously, with the Pasteur network. But you know, more than 200 R&D and access partners in different regions, 47 to be precise, as far as 2023 is concerned. Several clinical sites in different countries where we've been engaging in working consistently, creating capacity, creating knowledge, creating know-how. And some of you and some of the Pasteur institutions are part of this mapping, by the way. We've got different offices spread around the planet, which I'm in charge of coordinating and driving to a strategic level. And of course, the founding partners still continue to play a very important strategic role, but also implementing and political role in our endeavors. So just a quick map. Next slide is trying to reflect, and thanks for Cecilia and Hisham to share, a bit a connection of something you know very well. So I'm in no way going to present it. It's completely taking your slides, but to show the connection with the Pasteur network and how we feel very inspired, first by what you have been able to do throughout the several decades, but also what the opportunities are certainly for the world tomorrow, and our collaboration with DNDi and Pasteur is at the core of our strategy today. So next slide, Bushra, kindly, is a little bit of more detail, elaborating on what we are and where we are. At the center are our partners. Center column is basically, essentially in endemic countries, more than 60% of our partners. We have partners worldwide, and as you can see by different categories, sort of UNDP categorization on the income generation, but also in the different geographies. So in a way, reflecting a bit your footprint as well. Similarly, the diversity and range of alliances and partnership goes from, collaboration with, big pharma, small pharma. There's huge industry partners in DNDi and who have been able to help us make the success we have had in the last few years. It's been essential, the collaboration with the industry, with universities, with research centers, with the Ministry of Health, working hand in hand with the non-profit sector, MSF, but many other local organizations, and obviously at healthcare level very much with healthcare provider, but also patient and patient community. On the other hand, on the left-hand side of the slide, you'll see, Bushra, just up quickly, is the numbers just of people, because we're made of people, and we like to call ourselves a virtual model, because in a way we do not have, as you understand, our own laboratories. We work with our partners' laboratory. Our capacity to develop drugs is manufactured by the industry. We basically orchestrate a big orchestra worldwide. And, this number, the strength in numbers is basically the people that we employ, but also the partners, FTE partners that make this story possible. So it's very much about people, and we're very a patient-centric organization, but also a people-centric organization in our culture, as for those who don't know us. So next slide is indeed, when we looked, it's really about key strategic contribution from the international network around building partnerships in different ecosystems for innovation and ecosystem for access as well, building clinical trials, working with existing clinical trials, at times literally building, but at times also consolidating more than trials, but knowledge and data, working around innovation of new treatment, but also access and making sure the treatment are not on shelves, but do get into patients and the health system. A lot of business development behind. We like to see ourselves, of course, generated by MSF as a policy advocacy driven organization. We speak out, we show where things where there are gaps and what are the mechanisms of gaps and how solutions. So we are a constructive advocacy organization looking for solutions. And obviously a lot of our work in the different network is to look for resources. I won't hide it, both knowledge and people, but also financial resources. It's been our part of our strategy to diversify our funding sources and experiences in places like Brazil, India, or Malaysia. Has been really interesting to see how public funding is actually pouring into these new ventures that we're putting in place. Last slide is really a quick overview on why we see for us, and this is taken again from the Pasteur slides, what the Pasteur network matters to us. And as I was saying earlier, really part of our ambition to consolidate. There's a long history with Pasteur that you will see, maybe next slide, Bushra, a long consolidation of work with Pasteur in different parts of the world, and very much collaborations with many of the existing institutes. Many of you are around the table with Noel from Conakry, but we have also obviously an ambition to do more. A lot of collaboration historically with Institut Pasteur Paris, of course, also part of our scientific advisory committee, essential role in our governance, but we like to extend and globalize the collaboration with the Pasteur network in the next few years. Okay, that's for me. Leaving the floor now to Isabela, which has a lot of much more exciting things to say now to the group. Isabela. Sure.
All right, because Eric and I are in the same room. And so sorry for this. So just to give you, after this introduction from Eric, I just wanted to give you a little bit of an overview of the work that we've been doing across different disease areas and programs. Next slide. So over this 20 plus years that we've been working, we have delivered on 13 treatments, and really already, as indicated, we really work to discover, develop, and try to accelerate access to treatments to neglected populations. We have over this period worked initially on 6 diseases. I'll go that in more detail in subsequent slides. In conducting this virtual orchestra, as indicated by Eric, we have established a number of research networks over the years with 5 clinical research networks, 4 LEADOP consortia, and in actually implementing the number of clinical trials that we have. We have on average about 20 active clinical studies per year, and often, and we have today really a quite robust R&D pipelines with about 19 new chemical entities, but over the years about 4 million compounds screened, and we have about in the order of about 8 projects in phase 3 and registration phase. And we work in partnerships, as already indicated by Eric, with like over 220 plus partnerships in different countries, and quite a rich, diverse global team. Next slide. The diseases that we concentrate, we started from when we were launched. We concentrated initially on the kinetoplasty diseases, sleeping sickness, leishmaniasis, and Chagas disease. And we had a program on malaria, which has since been now delivered on its objectives, and access is has been actually moved to MMV. We have now also work on filaria, mycetoma, dengue, the most recently integrated disease in our portfolio, HIV, concentrating now very much on advanced HIV, hepatitis C. We had a program certainly on COVID and pandemic-prone diseases, and some new areas of disease that we are continuously exploring, but today 3 that are currently selected in terms of focus. Next slide. We have here the R&D portfolio of our organization, so really working from bench to bedside, from discovery to implementation and access. And on the right here, we have listed some of the treatments that we have delivered over the years, and in particular, and I will give you a few examples. In particular, I will focus on sleeping sickness, because I think it's actually one of the programs that have where we have gone from a time where we only had a target product profile, which then evolved, and we're now treatments in implementation. Leishmania, as you can see, certainly treatments already delivered, and really for really a quite rich portfolio today in terms of in development phase, but also in translation, and where we are now, particularly with the number of projects already moving in translation in phase 1, that we can decrease our drug discovery activities. And here you see, therefore, some diseases where we are working, like Chagas, that we go from discovery to access, but other diseases where we focus very much already just on the clinical phase, on actually optimizing treatment regimens, or developing new drug delivery systems, and so on. So next slide. So just to give one example here on sleeping sickness, right? It's one of these diseases where the rare examples of diseases where we're really now moving towards sustainable disease elimination. And when we started many years ago, we were in a situation where only the arsenic-based regimens were available. You had melarsoprol, where significant proportion of patients would actually develop arsenic reactive encephalopathy, and where really the goal at that time was in some way the killing. It's actually the substitution of the then available melarsoprol treatment Our work focused initially on delivering NACT, which was our first, one of our first deliverables, and which was an nifurtimox-eflornithine combination treatment, which was already safer, highly efficacious for second stage, late stage head. And then moving towards to an oral treatment, which was fexinidazole, which was the first new chemical entity that DNDi developed and delivered together with partners. And among these partners, actually, we have colleagues from Institut Pasteur and also in the work that has been done in Guinea. And we have, so fexinidazole actually was, the indication was broadened. It's actually, it's now an implementation phase. And now we are actually in a phase where we are developing and now actually at the time where we concluded our clinical trials on acoziborole, which here it's a single dose oral treatment and with really high success rates in phase 3 clinical trials. So it's really, really an enormous change, transformative, disruptive, and really a tool to accelerate sustainable disease elimination. So, over this, from the initial engagement to where we are today, certainly an enormous progress and towards actually development of simplified tests and treatments to support control and elimination. So next. So when we look here there is some directions into the portfolio evolution. I presented to you our current portfolio. There are areas that we, through consultation with different stakeholders and scientific reviews, etc., we have evaluations that are ongoing in 3 areas. One is on snake bite envenoming. The other one is schistosomiasis, where we already had an initial positioning from our board towards integration in where we are focusing very much on alternative treatments to praziquantel, but also on the treatment to female genital schistosomiasis, and rabies, where here we have the potential and to develop therapeutic option for treatment of rabies. And an example here of a very close collaboration with Institut Pasteur. And so here, one of these examples, an area where we're looking very closely and where we see certainly without the partnership with Pasteur, it would not be possible to take this forward. So next slide. I'll talk a little bit about dengue, right? So dengue, as I noted before, it's the disease that we more recently integrated. And here, the approach that we take, certainly the numbers in dengue are quite striking with the 4 billion population at risk, the 400 million infections per year, and certainly endemic across the globe, and with climate change, this pattern really of really important numbers and with record numbers over being beaten year after year. At the same time, we have a situation where you have progress in terms of delivering, you have new vaccines, new vector control strategies, but no existing treatments, right? And so it's a situation where certainly there is management of the disease and with risk stratification and adequate management. However, no existing treatments to try to prevent progression to severe disease. And our consultations here is that there are opportunities and certainly there is window of opportunity to meet this need, that we need to be thinking like with the learnings from COVID, that you need a portfolio of countermeasures, right, on different diseases. So we will need the vaccines, we need the vector control, but we need treatments and diagnostics. And here there are opportunities on small molecules and an evolving portfolio small molecules and also on biologicals, and the learned opportunities from portfolio from COVID and for cross-fertilization here. And we have some goals here in terms of advancing solutions to prevent progression to severe disease. One of the ways we are approaching dengue all along is one where we really feel that that it's important. There is important a lot of opportunity from disease endemic country leadership and involvement, and so really towards that where one can increase dengue research and development. So it's starting from accelerating evaluation of repurposing agents and also bringing in novel treatments, both in terms of monotherapy and combination. We're looking at antivirals, but also looking on host-directed treatment and to be deployed. And obviously with taking access in mind from the beginning. Really, we want affordable, sustainable, adapted treatments to be used in resource-limited settings and suitable to children and adults and the elderly. Next slide. So our approach and a strategy in dengue is one of we're focusing on an oral treatment for patients of all ages with preventing progression to disease. In one hand, we need to correctly identify patients with dengue, so we need good tools to identify those patients fast. We need to identify those that need the most, so tools for risk stratification. And then we need the tools to treat and prevent progression to severe disease. That's our approach initially. Certainly there are needs in severe dengue, but when we look at the burden and the importance, so it's actually from the consultations that we wanted to focus on the tools that would have the higher public health impact, and this is where we are really working in establishing not a network to actually evaluate these tools in terms of treatment and diagnostics and biomarkers. Next slide. We set up this Dengue Alliance, and which initially with partners from Oswaldo Cruz Foundation, Federal University of Minas Gerais in Brazil, THSTI in India, Ministry of Health of Malaysia, Siriraj Mahidol University in Thailand, and working together with DNDi. DNDi is the secretariat for this alliance. We set up preclinical, clinical work and a translational working group with different, with a really membership from a diverse number of members from a number of different institutions. And here I wanted to flag the opportunity for collaboration and actually put as a question mark, but certainly we very much would like, engagement and the network in terms of opportunities here for working together, right? There are the needs in dengue are many, and it is a disease for which really, when we look at the landscape in therapeutics, there are some here and there, but there is so much to be done. Next slide. We have one specific example of a collaboration with Pasteur. Here's Institut Pasteur Dakar. We have set up this. One of when we were doing, as we were working to integrate dengue, one of the things that came up was the fact of the lack of robust or actually systematically collected data in terms of actually understanding the problem of dengue in Africa. Right? Certainly there are outbreaks, there is, but actually there is still a number of unknowns. So initially, together with Institut Pasteur Dakar, also DRC and colleagues and KCCR in Ghana, we set up this retrospective cross-sectional studies, taking the opportunity from this very nice SARS-CoV-2 seroprevalence surveys, and from here working to basically develop information in terms of dengue force of infection and in these different countries, but also looking at, we took the opportunity to look at different tools in terms of the ELISA assays, multiplex immunoassays, and also doing PRNT. And on the multiplex, we actually did not only dengue, but we also looked across a number of different viruses, such as chikungunya, West Nile. We looked at Zika and yellow fever, and Usutu and Onyong viruses. And so really a starting point, very rich in terms of actually having an initial look in at least in these 3 countries with age stratified data across. So it's a nice existing collaboration, which we really want to expand. Next slide, and about to close. Just to hear from this initial Serodan study, we're working to, I forgot to mention as an important collaborator in the previous, we're actually working also with Imperial College, with IRD, and IRSHA in India. It's important to acknowledge our different partners there. But here also moving beyond the Serodan, we are working with Imperial College in this new epidemiological studies that to build on this assessment in the 3 countries. Next slide. So as we conclude, just so a number of synergies and opportunities, I think, to join efforts. There are examples. Eric touched on some. I gave a few examples. I should have mentioned, for example, also on dengue, the fact that some of the in vitro assays that were done in Institute Pasteur Korea. The list from Eric didn't mention dengue, and actually IPK actually did some of the in vitro assays on the repurposing agents on the 24 anyway. So DNDi with its expertise in drug development on neglected diseases for neglected populations, and at the same time Pasteur with its extensive network. So really a number of examples for the last 20 years, lots of opportunity to do more, and we really look forward to hearing from you and doing more together. Thank you.